The first presentation took 3 hours, but we had 67 attendees. The second one was a little over an hour. We had, I think it was 27 attendees. I don't know that I can get it in less than an hour for you, but we'll do our best.
Okay.
So the first thing I want to do as part of this is acknowledge that we're in a state of change, and we're in a state of fear associated with our society. We've not lived through a state of pandemic before. There's a lot of things that are out there making people uncomfortable, not just the virus itself, but also the protests going on and the fallout from that. We acknowledge that people are stressed. We're trying to make sure to alleviate those stresses as much as we can. We know that we can't alleviate all of them, but we are going to do our best for that. And particularly in the larger group, there was concern if there would be any active dialogue, I would have to mute people, but that never occurred. Everyone was very civil, very polite, taking turns. So it's been very cordial so far throughout this discussion. So I've been very pleased by their society by that. Let me get I've got a little agenda that I go through. So to let you know, I am actually an at-risk person myself. I have a rare primary immune deficiency. It is hereditary. My body doesn't produce certain parts of the blood that fight off infection. So I have to get regular infusions. Because of that, in the time I was as a youth, they didn't have as good a medicine as they do now. I have severe lung damage. I have so much scarring that x-rays are useless. They have to do MRIs to determine if I have an infection, let alone pneumonia. I've had the lower left lobe of my lung removed. So I hit several other factors such as high blood pressure and whatnot. So I hit several of the at-risk factors. That said, because of my background, I've lived in some of the state that some people are in now of fear, because I've always had the risk of dying of pneumonia. I've known since I was a very young child that that is what I would die of. Because at the time, they didn't have anyone who survived past the age of 18 with my disease. All of them died of pneumonia. I'm a sixth generation, there were 5 before me. I'm the first male to live past the age of 8 in my family. So I do take all of this very seriously. I take a look at all the sides of it and weigh the risk. And sometimes it's hard to weigh risks of people, but I want to serve our community and allow those who can and feel comfortable to come out. We're not forcing anyone to come out. We think we've made some reasonable efforts to do that. With regards to how we're doing this, I'm going to start sharing different things, and hopefully I've got a better setup tonight than I did the last 2 nights. For some reason, Zoom keeps moving my screens around willy-nilly. And so I don't always get the material I want and be able to see people. And it did exactly what I was expecting. Lovely. But luckily I can see you guys. So there's fewer of you tonight, so I can actually see you. So we're basing a lot of this off the CDC guidance and their data. We are directly downloading from USAFacts. They have a COVID data tracker. It tracks by county for the US, all states and territories. We're using their guidance with some of this, with a little bit of fudging they'll talk about when we get into the data analytics portion. We've got the information on how COVID spreads, the open up plan from the CDC for people to read, some of the pandemic preparedness, about the health surveys and things like that, as well as their published self-checker. In order to go into phase 1 of a reopen plan, the state must meet the gating criteria. There are 3 portions of this, with the middle one being an either or. The first one is they must have a downward trajectory of reported symptoms. This is flu-like symptoms and others of the nature within a 14-day period. Unfortunately, I cannot find any data sets publishing that, so I can't do any analysis off of it. We then have to have either a downward trajectory of documented cases within a 14-day period, or a downward trajectory of positive cases as a percent of total cases tested for COVID within that 14-day period. And the hospitals have to be able to treat all patients without crisis care and have testing programs in place for all their critical workers. Early on, this was a part of the reason they stopped doing elective surgeries and other stuff, because of the capacity for hospitals. Those have all reopened and they're moving forward. With regards to what the things are as they sort of relate to martial activities, vulnerable individuals, which is a fairly comprehensive list of over 65, immune suppressed, et cetera, should shelter in place, just as they did before the reopening. And social settings of 10 or more, where distancing is not practical or may not be practical, should be avoided unless you can take precautionary measures such as face masks, frequent hand sanitation, and cough and sneeze etiquette. I know that that has been one of those confusing points, because they talk about the groups of 10 or more, but they don't talk about the precautionary measures with regards to those. To go into phase 2, there has to be no obvious, oh, we got someone else coming in who I'm pretty sure has already been here, but let's let them in. There has to be no evidence of a rebound, and they must meet the gating criteria a second time. So you've now got 28 days of this type of trending. At that point, at phase 2, they still encourage the vulnerable folks to stay home, and they increase the group sizes to 50 individuals. And where not practical for distancing, to use the precautionary measures. To go into phase 3, again, no evidence of a rebound, and again, meet the gating criteria. So you're now at whatever many days that is, 42 days of the trends. At that point, vulnerable individuals can resume public interaction, but they should be using safety precautions such as face masks and frequent hand sanitation and stuff. Low risk populations, which is the most of the people in the world, should consider minimizing time spent in crowded environments. I got someone else joining. So crowded environments is anything from a full mall to a large party at, say, a concert or something like that. The crowded environments could be because of space constraints, or it could be just sheer numbers of people. The CDC guidelines of a large event is more than 250, but that was for the earlier phases of consider canceling these types of events. They're now allowed, people can go. Any questions about the CDC guidance before I get into the state guidance? Okay. So Texas, here's the data that it has in the different areas. Texas entered phase 1 on May 1st. Their general guidance was slightly stricter than the CDC's guidance. They wanted the at-risk people to stay home still, which is in alignment. They had the group size of larger than 10. And then they said that outdoor sports should not have more than 4 active participants and no bodily contact. I didn't bother putting the no bodily contact here, but because for our plan it's irrelevant. But that means that for that, they allowed people like golf, they allowed tennis, they didn't allow basketball, they didn't allow football, baseball, those types of sports. And they only allowed them outdoors. Texas went into phase 2 on May 18th. Vulnerable populations should continue to shelter in place. Texas kept the social groups larger than 10. And they said sports may resume practicing without spectators May 31st, and competitions with spectators starting June 15th for phase 2. We moved into phase 3 on June 3rd. They still are encouraged vulnerable people to stay home as much as possible, but to be aware of the large gatherings and significant risks. They worded it a little bit differently than the CDC, but it's very similar guidance. They said that for large outdoor events, which are defined as 500 or more attendees, that individuals should attempt to maintain 6 feet of separation from their group, their pod, their bubble, whatever you want to call it, which is those in your household and people you traveled with to the event. If you can't maintain it, then you follow the proper safety measures of covering your face, frequent hand washing, etc. And then adult recreational sports may resume. Spectators should maintain at least 5 feet distance from other individuals outside of their group. And they said that adult recreational sports participants should consider wearing a face mask when participating in these. One of the things I don't know if you caught earlier when I was talking about the CDC, phase 3 does not require face masks except for vulnerable people. Texas has a few places where they're still encouraging it, including sports participants because of the increased risk associated with respiratory particulates. We then go into Oklahoma's. We've got their data plans, their plan. They entered phase 1 on April 24th. They followed exactly the CDC guidelines. They went into phase 2 on May 15th with exactly the CDC guidelines. And they entered phase 3 on June 1st with exactly the CDC guidelines. So Texas has actually been more restrictive. They actually slowed down which businesses can open in different phases. Events for the SCA cannot happen until phase 3.
Okay.
This is all about martial practices, not events. Any other questions about this? And I actually got few enough people I can see the chat and the people and keep track, hopefully. All right. One of the things that came up last night, and I thought it was great because they were allowing me to do this in a very good way. They asked about the trends because they were of the opinion that neither of the states had met the trends and they were just opening willy-nilly. That is not actually the case. Did that actually show up for you guys? Yes, there it is. Zoom is horrible about putting screens behind screens. Sorry, every time I pause like that, it's because someone's joining and I have to restart my brain. With regards to new case trends, maroon is Oklahoma, the sort of orangish is Texas. You'll see the dotted line is the trend line over the month of May. It is a downward trend. Yeah, you've got spikes here and there, but overall the trend is downward. Texas is a dotted line, but it's a very slight upward trend. So Oklahoma met this definitely on the case trends. I don't know about their testing data because they don't publish it granular enough for me to figure that out. Texas does publish their testing data granular enough to figure it out. That's the other chart down here. Same time period, you can see the testing trend of positive cases to total people tested is a downward trend. So it's meeting that either or gate that the CDC has. Any questions about the trends and how we achieve the gates? All right. Now I keep going back and forth, sharing different screens. All right, we're going back here. So this is the page that I know some people have read, but not necessarily everyone, but I'm going to go through it in generalities. I'm not going to try to hit all the specific things, but if you have questions, let me know. So we're trying to do this in a phased approach. That was more apropos when I started this plan at the beginning of May. But to get all of the data, to get our feedback from our different people, from risk management, doctors, data analytics people, It's taken us a while to get this to a place that we're comfortable with releasing it. There were some things that had to be based off the audience participation. We have clarified some of the wording in this to make it more clear to people. It made obvious sense to me because I knew it inside and out, but other people are having problems interpreting it. We've made a few changes to make sure it's more clear. One of the things to be aware of is that as we're doing this, because we're doing it down to the county level for data, ours may be more restrictive than the state. So we may have a lower phase than the state does, or we may be closed entirely for some branches if they're having a substantial transmission within their local community at points in time. We're going to publish the reports on Fridays. We chose Fridays because after watching the data get updated for several weeks, we noticed that that was going to be the most reliable day to have all the trickle through data from the cities to the counties to the states to the national level, because of the challenges with weekends in particular, causing big swings if you didn't wait until those had trickled up. So we're doing it on those days in order to have that trickle up, not cause massive swings of trend lines. The data gets backdated to when it came up through the system. We update it Friday mornings when we do this. Was there a question? No, okay. Ansteorra is going to trail by at least 2 weeks of the local phasing in order to capture any localized rebound from the reopening exercises. We thought this was prudent because it's between 2 and 14 days, depending on who you ask, of how long it takes for people to show symptoms. Most seem to happen within 9, but it can be as long as 14. So 2 weeks, we thought that would capture the data. Branch statuses will either be a absolute stop sign, no activity, martial activities allowed at all, or the stated phase that they're allowed to do. These are the summaries of it. I'm going to go into the specific phases of it as we get down into each phase. But this is just an overview. Local government and tribal jurisdiction guidance is always stricter than, or will always trump Ansteorra's guidance. So if your local government is saying, we're not allowing these activities, we can't know all of those governments, so we can't make that decision at the kingdom level. That would have to be made at the local level. We have had some asks for helping with interpreting how the SCA is classified in some jurisdictions, because there are different classifications of team sports, outdoor sports, gyms, et cetera, et cetera. So when those happen, either myself or Avery will help the local branch to determine what is the correct classification based off their guidance. We will do these recurring sessions. We're doing them real heavily right now, although tonight's not a big attendance. We thought having 3 of them right as we're announcing it was the best option to get good, quick feedback. I admit I did kind of poke the bear with how I announced this with regards to that. I had announced it in the Black Star that we were developing our plan. I'd announced it in the middle of May that we were developing a plan. And I got 0 feedback from anybody about this. And then you saw, as I made the announcement, that then there was a lot of uproar. That was kind of on purpose. We knew that it would probably be delayed another week from the earliest date I had stated in that, but we wanted people to have the time to vent. We think that's healthy for them. You get some of that angst out. There's a lot of issues with mental health going on because of all the people being away from social contact. And we think it's important to have people vent their concerns, raise their concerns up to us and see if we can address them. So I did kind of do that on purpose the way I did it. If we get contacted by a tracing program, both states have tracing programs for COVID exposure. We will shut down all SE activities for that afflicted branch. So that is more than just martial activities. I have approval with the Kingdom, Seneschal, and Crown that we're closing everything down for 2 weeks to make sure that we're not continuing to spread it within the local branch. And we also want any of our officers or warranted marshals that are in attendance who see COVID-like symptoms to ask the person to leave. As I mentioned, as we were starting the generalities, we don't want anyone to put themselves at risk. So if a local marshal is unable or unwilling to attend, they need to try to find a deputy to hold the practices. If the local marshal can't, they should notify their upline so that we know which groups are not able to hold practices. We are creating a petition process that if we get 4 or more participants of the same marshal form, they can petition up for consideration on resuming activities. That was put in case we had a local marshal who was being a little more zealot about having things closed down. But it will take different considerations into a fact of how long have these people been in a marshal participant? Are they a marshal or not? Do they have the appropriate knowledge to understand what's going on? All those different factors are going to go into that decision. It doesn't mean that they will be approved, but they can at least request a consideration for it. Because of the pandemic, and it's going to be ongoing potentially, depending on who you ask, up to 2 years. And there are only 3 phases of reopening. So we could be in phase 3 for multiple years, depending on the CDC's classification of a pandemic, if we don't see rebounds within our states. But because of that, there could be lower attendance. And so some branches just may not have practices because they don't have enough people willing to come out. They have too many at-risk people, various factors. So we're acknowledging that that may happen, and it's okay. While it has always been true, we're emphasizing that individuals have the right not to face an opponent at practices. It seems like a no-brainer, but we wanted to emphasize that in case someone thought someone else was an at-risk individual because of their lifestyle or something, that they didn't have to fight them, just to reiterate that. We want no one to intentionally violate the guidance, nor do we want people intentionally disparaging people for their participation. Whether they're participating or not participating, we don't want people ridiculing them for that decision. With regard to those, we will have, we want those reported up to the Kingdom level as quickly as possible. For the lack of compliance with the marshal safety measures, that would go to myself. With regards to any bullying claims, which is what berating people about attendance or not are, we go to the Kingdom Seneschal. Rule number 1 is always in effect. Rule number 1 is don't be a dick. That's actually from Will Wheaton from several years back. It's very appropriate. Let's make sure to follow it. The website does have the full analytics of how we're doing this. I'll be covering those once I get through here. So people can see how we're doing it. They can make sure that the functions are done correctly. They can see if they can identify risks that we didn't see with regards to some of the assumptions that were made with the analytics, those types of things. One thing I didn't talk about when I was on the testing ratio, or the testing data, the CDC wants states to be below 10% positive to total test case in order to be considered a satisfactory testing program. Both states have done that. Oklahoma is lower than Texas. I don't know by how much because Oklahoma is not publishing their data. Sorry about that. To go, any questions about the general parts of this before I go into the specific things? As I said, this may be real easy given how many people I got, but you guys will get as much time as you need to clarify stuff, so don't be afraid. In phase one, martial activities must be outdoors, no indoor activities. They are limited to target archery, thrown weapons, and equestrian. These are activities that are easily distanced from each other while you're performing the activity. It's limited to the participants, the marshal, and any required officers. We're not allowing minors to participate in any way in phase one. We don't want the challenges of oversight of the COVID safety with the line safety to be in conflict. So we want to get people used to this before we add that potentially new challenge to it. We're explicitly calling out that no combat, including mounted combat, is allowed. You can do equestrian games, you can do equestrian archery, but no mounted combat. Because of how the size of group works, multiple martial activities are allowed at the same physical location, as long as they can give a clear separation of at least 10 feet between the groups. The group sizes should be limited to 10 people, but we can have multiple at any particular site. For example, in Bringalod, our normal practice site holds both rapier and armored combat. They're 70, 80 feet apart from each other, not a problem. On the rapier side, we'd have to break up into smaller groups because we usually have more than 10 people, but that's fine as long as you keep that 10-foot distance. And it's going to vary greatly on locations on if that's feasible or not for your practices. We're not allowing more than any more than 4 individuals to participate at a time. So no more than 4 people shooting archery at a time, no more than 4 people doing thrown weapons, etc. Everyone must wear a face mask covering mouth and nose or equivalent. They can either need to be commercially manufactured or following the CDC guidance for do-it-yourself. And I'm sure people have seen YouTube videos and whatnot on those all over the place by this time of day. If you cannot maintain 6 feet of separation from outside your residence because of something going on with the activity, you need to follow hand hygiene and cough sneeze etiquette in addition to the face mask. Prior to participation, individuals have to acknowledge a health screening questionnaire. That health screening questionnaire is straight off the CDC questions of having a fever, persistent cough that's not related to seasonal allergies. If you're experiencing anything that's out of the ordinary with regards to shaking or headaches or difficulty breathing, it's key to note that these are out of the ordinary. This time of year, people have seasonal allergies. That is not a COVID-like symptom. It has to be in association with multiple aspects that are non-allergies. With me missing a lung, I often have shortness of breath. It's not abnormal. So people who have these types of conditions are used to answering these type of questionnaires correctly. But we want to make sure people understand that. And then in the last 14 days, have you been caring for or been in close contact with someone who has been positively diagnosed? Or visited one of the USA's restricted entry countries that requires you to, they recommend that you self-quarantine. We are not going to allow those people to participate in our activities. So that's what the health questionnaire is going to look like. If you answer yes to any of them, you're not allowed to participate, you need to leave. We're going to attempt to do some additional reduction of contact transfer. While there is a low risk associated with contact transfer, we want to do what we can to keep our participants safe. We're trying to implement an electronic waiver signature, for example. We don't know if we're going to be successful in meeting the corporate's requirements for that, but we've tentatively been given approval. We just need to get the technical aspects of that worked out. When performing inspections, both individuals must be wearing a mask. That's a given, but we're reinforcing it here. They need to minimize the physical contact to only what's necessary to perform the inspection. They should clean their hands before and after. but they need to be careful of how often they do that and what they use, so they don't they don't dry out their hands and make them crack and become bloody, because that's actually putting you at more risk than if you hadn't cleaned them at all. When feasible, inspect the equipment 6 feet away from the other people. That will vary by the marshal form for that. In phase 1, we're allowing no use of loaner equipment. We're saying that the activities should have a distance of 10 feet apart from each other. And we're not allowing shared food or drinks, so that we reduce those contact transfers, vectors. We're strongly encouraging groups to make available and or have donations of face masks and hand sanitizer to help those who can't afford it themselves, and to make sure that it's present at practices in case someone forgot theirs that evening. And we're encouraging the at-risk people, and we're iterating what that is by the CDC guidance here, to stay home as much as possible. We will not enforce this based off the government guidance. For most things, you're not allowed to ask people these questions. People need to self-govern themselves. Any questions on phase 1? Oh, come on, people. All right, phase 2. We're resuming all adult martial activities. So no youth combat, no youth rapier. They can be either indoors or outdoors. Indoor limits are going to be determined by the facility owner with their local guidance. We can't know what the guidance is for each type of facility, because gyms have a different one than basketball courts have a different one than just open auditoriums. So each facility owner knows their rules. They set the limits for those. We're not going to try to figure that out. As I mentioned earlier, Texas is more strict than CDC, so the groups are still going to be limited to 10. You can still have multiple ones at one practice, as I mentioned earlier. We're potentially allowing minors under the age of 12 to participate in live weapons, so target archery and thrown weapons. So we'll allow a parent or guardian with them if they do. If we disallow that, we'll strike that portion. Texas is not allowing spectators at this time because of the regulations of the local area in phase 2. Oklahoma, as it follows CDC guidelines, those groups are limited to 50. That's fairly large. We've only got a few groups that may hit that. We're discouraging non-participants, so we're discouraging spectators in order to keep us below that limit and to reduce additional vectors where it's not necessary to participate in this activity. We're allowing small unit melees, up to 5 combatants per side. That's an arbitrary number. We took 10 and divided it by 2 to get 5. And we're only allowing one melee at a time. But we're not going to limit the number of active bouts or firing lanes that happen. Everyone wears a face mask. We're still 6 feet apart, or follow the additional safety precautions. And we still have the health screening. Rabia, did you have a question, Jan? Okay. The non-contact is the same. Once we decide we're going to, with me and the Crown and Kingdom Seneschal decide, we're going to request a variance about the face mask and helm inspection. There's a part where you have to put pressure on the front of the mask. We're going to see if we can have a variance for that during this time period. This will be updated associated with that once we hear one way or the other back. We are allowing loaner equipment to be used if it is properly disinfected between individuals. That is a hot link to the CDC guidance of what disinfecting means for different materials and whatnot. For most of our equipment, Lysol is a wonderful disinfectant. It kills coronavirus, it kills SARS-CoV-2/COVID. The procedure for that will be determined at the local branch level. And we're saying that if they want to, they can either temporarily loan equipment out to people for an extended time period so they don't have to disinfect it between uses, or they can disallow it entirely. It's never been a requirement from the kingdom that groups have loaner equipment. We think it is good in order to encourage people, but particularly in phase 2, we don't know if we want just walk-ups happening, so some groups may be more comfortable not allowing loaner equipment. But that said, we have some of our membership that require it because of their financing, so we do want that flexibility to exist. We're reducing the distance between the fighting areas and the fire lanes to 6 feet. That's still above the CDC guidance for close proximity. We're still disallowing food and drink, shared food and drinks. One of the things, because we're now allowing combat, is we're telling, let me be clear on that, the warranted marshals, which includes the local officer, as well as authorizing marshals, and the combatants to call hold to break up fighting with extended close proximity, where you could potentially have that respiratory particulates going between the individuals. While the mask or, I got to skip back up a little bit in a second, where the mask or the face shield reduces that risk, it does not 100% eliminate it. So we want to reduce the amount of time that we're that close just to further reduce the risk. One of the things we're allowing is the use of a solid plastic or other material face shield affixed to the helm that covers the mouth and nose. It needs to be, it can be below the eyes, but it has to be above the tip of the nose. We've been doing practices locally, unofficially, to play test this, because one of the doctors recommended we play test it, particularly because we're in Ansteorra and it gets hot here. So we've play tested both of these. You definitely do, when doing combat, get more tired and more hot. It is more important that you do proper breathing technique. So we expect there will be shorter bouts with people because of that. When we use the clear plastic face shield, the thing we did notice with that when we didn't use it with a face mask is it becomes very obvious how much respiratory particulates are happening while we're doing combat. It's rather nasty and gets this nice coating of stuff on the inside of that plastic, but it does not go above the nose. So that's why we're setting it above the nose. It can go all the way up, but it has to at least be above the nose. If people want to use both, they can, but we're saying either or is acceptable. Nothing else changed in there. Any questions about phase 2?
I do. Hi, it's Sonia.
Yes.
So regarding the spectators, what is your guidance for, say, LC has a fighter practice, we have it in a park, and it draws attention. They're not our spectators. Are we encouraged to have them dissipate since they're not part of our practice? They're just watching, not take into account, or not go up and talk to them? How do we handle
the walk-ups?
Yeah.
Yeah. Right now, that's been actually an active conversation the last few days. What we're most likely going to recommend is that one person peels off from the group and goes and approaches them to ask them to stay back because of the regulation, for our safety regulations for COVID. They're welcome to stay apart and watch, and that person can talk to them and be a hospitaller. But I don't know that we necessarily want them joining. But each group will be allowed to decide if they want walk-ups to happen at this point. That may change when I talk to the Crown and Kingdom Seneschal tomorrow night.
Gotcha, thanks.
Particularly in phase 2.
Yep.
Baroness Cat, that is not a bad idea at all. We're actually looking at some literature to put up with regards to the COVID safety and having some normal the business cards and bookmarks and other stuff is not a bad idea for those walk-ups. I'm not much of a hospitaller, so I admit I'm not good at thinking of those things. Was that it, Your Excellency? All right, phase 3.
Oh, hold on.
Oh yeah.
Are there guidelines for the type of plastic or thickness of plastics for the face shields, and any guidelines for how they should be affixed to masks, like rapier masks versus heavy or armor combat masks?
We encourage them to be on the inside so that they don't get damaged during the fighting. The person, if they can affix it to the outside and not have it come off, that's perfectly fine. Most will find it as easier to affix it on the inside. It needs to be a solid plastic or solid material in order to block those particulates so they fall out. When we did our play testing, we used really cheap plastic, clear plastic file folders. That is plenty of material to do it. I mean, cloth at certain levels does it, but any solid material will definitely do it.
Okay, thank you.
I'm not sure who the Thrown Weapons Marshal of Amron is, but that is not a bad idea, to set up signs to ask people to remain back, but encourage them to watch. The zip tying or tape work both. We tried both of those. Closed helms is going to depend on the type of helm and how much perforation there is below the nose. We've already had people coming up with designs. Some people are just taping fully over those perforations during this part in order to do it, and that way they can take it off later. So it will be on a case-by-case basis to meet that or equivalence. But zip ties and tape both work for keeping it on the inside of the mask. On the outside, after a few fights, tape may release it, so they need to be more careful about that. Anything else? And I'm actually getting to see the chats tonight as opposed to the last two. This is a much more manageable group to talk to. For phase 3, we're resuming all adult and youth activities. That's pretty much what's going on in both states. I mean, amusements parks are open, everything's open. But we're going to have them prior to it. They still have to acknowledge the screening. We're still going to disinfect loaner equipment between uses. We're still going to limit shared food and drinks. We are still, until further notice, because we don't know how long this will last, and depending on what happens, we may lessen this at some point, that all individuals shall wear the face masks still, and same for the combatants. We acknowledge that given how this is with the CDC guidance, they don't require face masks at this point. We're doing it as an additional safety measure, particularly for combat. So we may lessen it for spectators before we lessen it for combatants. Well, no, we will lessen it for spectators before combatants, but we don't know when or if that'll happen during phase 3. Any questions on phase 3?
One question that occurred to me about acknowledging the health screening. Does that mean that there is a piece of paper with a health screening that people look at and, you know,
say yes or no?
Say yes or no, or is there an actual document that has to be checked or signed?
We are not doing any actual documents. We did look into that. While we are not covered under HIPAA regulations or some of the employment regulations, some people raised the concerns of us having that information, so we are choosing not to do it at this time.
Okay.
If this goes on for a while and if we start rebounding and coming back into these phases, we may reevaluate that so we have better tracing programs internal to the SCA, not just the ones publicly.
So that questionnaire is just a verbal?
It's just a verbal.
Okay, gotcha.
And sorry, I just
No, don't be sorry.
wondered this. So do we need to write down who was at each practice in case we are contacted for tracing?
We are not going to do that at this time. We are going, we'll have the waivers for those who are not Blue Card members because we plan to shut down all activities. Depending on what the tracing program wants from us, we may request people to reach out to the tracing program, but we're not going to be in the middle of the tracing program when at all possible.
Okay, thanks.
We don't want to be a bottleneck nor have necessarily information that may be considered sensitive by some individuals. All right, now I'm going to talk about the analytics portion of this. Some people find this interesting. Most find it horribly boring. I find it both at this point. So the first thing we're looking at here is a sample of the download from the USAFacts. As I mentioned, it has every county for every state and territory. We're downloading that on Friday mornings in order to do the analysis for. Based off that, it then jumps over to this second page where, let me get to the right spot. Oh, that's why I've scrolled over, sorry. Where we have a mapping of the branch to what counties and what states they are, and the population as of the most recent census, and then what their test cases are for that day. You'll notice that this is an ever increasing number because they don't ever remove people from the list, they only add people to the list. So we mapped every group to one or more counties. We did not map a county to more than one group. We have created a part of the stuff I didn't talk about because that people raised though was we are allowing groups that are in close proximity to each other. Particularly the one that came up really early in this was Namron and Wiesenfjord. They hold joint practices. They only hold joint practices. So in those cases, we are not going to report them as one group. We'll report each independently, but they have to use the lower of the phase. So if one of them is stopped, they're stopped. If one of them is at phase 1, they're all at phase 1. But that is for those joint practices. And I don't know where all those occur across the kingdom. So each area is going to do it. And I do know some groups have occasionally joint practices. Others have them regularly. Because I'm getting dark, I'm going to turn a light on. Try to keep the lights off and the shades closed because it's Texas in summer. You would be allowed to do that, yes. If one of the groups is, if the two groups decide to have separate practices, they're certainly allowed to. And since that came from Namron, and I think something else came from Namron when I was doing it with the senior marshals, there was a question that came up with regards to storage and use of personal property for practices. The site owner is the ruling factor. If they don't want you to have practice, we can't force them to have practices. Where it's in public parks and everything, we follow the local government guidance.
I want to clarify that.
Yep.
So Namron officially right now, our shift practices are combined. And we've been talking about for quite a while doing our thrown weapons practices combined. Now, if one of our baronies switches to full stop, can the other barony carry on doing a separate practice with just their own baronial people?
Yes, yes, they can. It's
Okay.
only those joint practices that it becomes an issue.
Okay.
And that's on a case-by-case basis, so absolutely fair. So that maps all the branches to counties, counties to population, counties to cases. As we go up through the data analytics, we figure out a daily change. So that group, I've now consolidated all the counties down into a single number. This is how many occurred on this day. This is how many occurred on this day. That's a simple mathematical thing for the formula. Because early on, there was concerns by different individuals that there were these peaks and valleys that showed up in some of the reporting. It showed up particularly early on with weekend reporting where some of the groups didn't report it. That has pretty much disappeared with this using the USAFacts data. But we're still calculating that just in case there seems to be some sort of anomaly with it. That may get dropped out at some point because it doesn't seem to have any significant factor on it, but we're using it as one of the data points. As we move up, we're then doing a weekly trend line. That's a simple mathematical formula of all the dots on the line. What is the slope of the line? Because that's what the CDC wants. This is a little confusing for people who look at finance versus what I'm doing here. Green is actually good. Negative is the best you can hope for. Where anything positive is a upward slope. So you're slightly increasing or significantly increasing depending on what the number is. Those in yellow, when I get to the last page, I'll explain. We picked an arbitrary number for a slight upward slope not having a significant detriment to the group. This came up fairly early on because there were some branches that were having 0 cases. And when they went from 0 to 1, there was suddenly an upward trend. Well, it wasn't a significant upward trend, but it was upward. For that one day, it's infinite, or 45 degrees, depending on how you look at it. But for over a week or 2 weeks, it was fairly negligible. So we have a little bit of fudge factor for dealing with those. You're really low and you go up a little bit to not completely penalize the group. But we do potentially reduce their phase they're in. As we move up, for this stuff over here, ignore it. It's something I'm working on as a proposal to change for improvement of stopped groups to resumption. But these things here are what we're looking at. So we've taken the group, we've configured the full population for the counties, the number of test cases over the last 14 days, and then what % of the population that is. We have one is a completely arbitrary number, the other is only slightly arbitrary. The fully arbitrary, we said 2 in 10,000 people is an okay rate. That seems to be, looking at the trend lines for population, seem to be an acceptable growth over 2-week period, where 3 in 10,000 was considered, or 3 in 1,000 was considered absolutely unacceptable. So the green ones are under 2 in 10,000 and the red are above 3 in 1,000. And we downgrade those groups for that. We then create the 14-day trajectories. With regard to this, you'll see here there's a small difference here between the daily average and the 3-day average. That's where we see a little bit of that, but it doesn't seem to have a significant impact on the analysis, so we may drop that out. But for now, we're still using it as a potential as part of this. Green are good, yellow are only slightly upward, everything else is upward. We then take that over to create what is normally called a stoplight chart. We originally had the status including stoplights, and that was confusing too many people because it was kind of irrelevant. The phase is what really mattered to them, because if we downgraded them, they were yellow. So why not just say they're phase 1 or phase 2, depending on what phase the government's in. And this just gives you that visual cue of how to look at it. We trust the trend line over the population. So if the trend line is green and the population is green or yellow, we consider you okay. You can be at the full phase. If the trend line is red and the population is either green or yellow, we reduce you 1 phase. So we see that there is a small transmission going on within your local community. We're going to downgrade you, but it wasn't a significant one like Ravensforth, where it hit both of our triggers. When it hits both of our triggers, we close you down. What we're looking at for that, and what I was telling you to ignore, is we're looking at, well, when one of those is no longer red, we want you to slowly go back to phase 1, phase 2, phase 3, instead of just going from stop to phase 3. We want to do a gradual movement upward instead of a dramatic movement upward. Any questions about the data analytics? And this is all downloadable to go look at. There is a warning on the website now because I do use 2 Excel functions that are only available in newer ones. But the only thing that does is put what status it's in. All the others are traditional Excel functions.
Mr. Pug, you mentioned on Thursdays where this data is coming from and when it's being downloaded into time frame. So I was just wondering if you could touch upon that in a little bit more detail. I did notice that ELSI on Thursday had a trend green, but now has a trend yellow. And I did see as you were scrolling that the numbers had changed a little bit as you get data. And Thursday was before you get the data on Fridays, correct?
That is correct. Originally I was trying to do this daily and updating it, and saw that it was having too much fluctuation through the week. So the data is downloaded from a nonprofit organization called USAFacts. They collate multiple data sources for state and federal government. It's actually the source that the CDC uses to generate their data tables and everything. I download it from them so that I can do it by county instead of just doing it by state, because the CDC really doesn't care below the state level. We are downloading it on Friday mornings because of those challenges we have with the trickle up from the city to county to state to national, especially over the weekends. If you would run the report on a Monday, you would see most groups were all green because the reports from the weekend haven't trickled up yet. We have all those trickle up by the time we do the report on Fridays, and they're all reporting on Fridays. The USAFacts site uploads their data at 11:58 p.m. Eastern. I will be doing these on Friday mornings, sometime before noon. I will be adding a time indicator on the website when we go live of when it's been updated, and we're going to put a visual indicator in the status of if a group went up or down or stopped entirely, so that people have a quick visual. Do I have to look for something different, or am I still good to go with what I was doing last week? Is that what you were looking for, you guys?
Yes, thank you very much.
You're welcome. So that is the entirety of my presentation. If you go to the website, and I'm going to have Avery send this out, the Crown's sending it out to Baronies, but we're going to have Avery send it out to all the Seneschals. Let me get back over and share the right screen, since I'm scrolling and you can't see what I'm scrolling. So on the website, since Friday, because of not needing everyone to go into the spreadsheet to figure out what their groups were, I just went ahead and copied and pasted this in here of which branches, which counties. So we're going to have the nobility and Seneschals look at this and make sure that we've got it mapped right. I did go through every county that had more than a population of 40,000 people in Texas and Oklahoma to determine if they should be associated with a branch. The only ones that I was able to identify that were not associated was the Brownsville-McAllen area, Victoria, Texas area, and the Abilene area. Those are the only places not currently associated with SCA groups that have a population of 40,000 or more within their county. All others are associated. Some that may be nearby groups may want to have in their numbers because the population lived there. From what I've seen of most of those, when they're below 40,000 with these populations we're talking about, they don't have a significant impact of what the group rating will be. But if there happened to be some sort of weird anomaly within the county, it could. But we're going to ask the Seneschals and nobility to help us adjust any of these to make sure that we're doing it correctly. And then after that, it's open questions for anything that's left outstanding. Anybody? Jan? I think you're getting ready.
Yes, sir. I just was following. I was at your first session, wanted to see if there were changes and things in the flow here. I think I've got a good understanding of what's going on. I've got some ideas on things I might do within the group. I can keep within your guidelines, I think, pretty carefully. I thank you for the work you put into this, sir.
I greatly appreciate that. I've had a lot of good feedback on it. I'm glad people are fairly pleased with it. We're not going to make everybody happy, but we're trying to make it safe and make our folks be able to resume activities. There is a risk that I have concerns of if we don't open SC activities, that people will find other hobbies, particularly if this goes on for a couple of years, like summer forecasting. Others say that it's worth the risk to stay closed. In the end, it'll be up to a committee of me, the Seneschal, and the Crown to determine when we resume activities. All right. Thank you both, or thank you all who showed up. Particularly thank you those who came for both sessions and sat through it. I'm glad this one was not 3 hours long like the original one. The others were much better. All right, thank you all. I will be uploading this one for other folks to view as soon as I can get it converted. Thank you all.
Thank you
Thank
very
you,
much.
sir.
Bye.
Bye.
Bye-bye.